Good afternoon, this is Doug. Could I get a sound check, please?
We can hear you and see you, Doug. Thank you. Dr. Miller, I see your video. If you'd like to check your audio, then go ahead. Nope, okay.
The hour of 2 o'clock having arrived, we will call the Health and Hospital Committee meeting to order, and we'll ask clerk to begin by calling the roll and establishing the presence of a quorum.
Vice Chairperson Lee,
Captain present.
Chairperson Smidian,
Present. We have a quorum. Thank you. Both members are present and accounted for. That takes us to the next item on our agenda, which is public comment. Public comment is that portion of our agenda set aside for comment by members of the public on non-agendized items. Let me ask clerk first how many folks we have here in chambers, if any, who would like to speak on public comment.
none in chambers, but one on Zoom.
All right, let's close off the queue after this first speaker is done with his or her remarks. So let's go ahead and hear from the person on Zoom. Go ahead and welcome them to our meeting, please.
Thank you. Our speaker on Zoom is Ben Z. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Yes, hello, good afternoon. It's at the last meeting, I asked Mr. Lorenz if he could help me with my kids who are being sexually abused, if he could get my kids a screening, because he did sign this sexual assault response protocol for Santa Clara County, and I figured if you're committing to it, it's something that's important. Otherwise, why would you slap it? And I mean, I can't understand you guys. I mean, I've asked other people on this committee if they could help, because I mean, some people here are mandated actors. I figured somebody could help, but nobody's helping. And it's just, on your part, I'm sorry to say, but it's really disgusting that you guys would allow my kids to be molested. I mean, like, we've already gone through, like, the Me Too movement. There's the Jeffrey Epstein saga.
Madam Clerk?
I see. Ben Z, are you still there? Oh.
Church scandal there.
Seems to be a slow connection. The microphone is open and active.
I apologize, Madam Clerk. Could you speak into your microphone a little more clearly so I can hear you?
Seems to be a slow connection.
You guys are forcing my kids to be abused. I mean, like, I don't see like how anybody wouldn't care about a 2-year-old being molested, how a 13-year-old being raped, how telling you guys this doesn't elicit some sort of response, a protective response. We should be protecting these kids. Something. Call my office. It's concerning that my kids that these kids are not being protected, and I'm not getting that sort of a response from you. And I mean, everybody in this county needs to be concerned about this, because it can happen to anybody's kids. It can happen to anybody in this county, and they could be getting the same sort of callous response that I'm getting. I mean, I posted all this information online. If anybody wants to see it, if you Google Valerie Houghton sex
All right, thank you very much. Madam Clerk, I gather that the speaker was having some technical difficulties with his Zoom equipment, yes?
That's my understanding.
And then, Mr. Press, I see your light is on, our county counsel's office.
Yes, I'd like to just offer some general guidance on some of the issues being discussed. So, a few things. California law prohibits the disclosure of information related to an investigation of suspected child abuse or neglect. And as a result, we are not authorized by law to speak to the specifics of any particular case, no matter the allegations. California law also requires child welfare departments to immediately cross-report physical and sexual abuse of children to law enforcement and the district attorney so that swift action can be taken when needed. The public can be assured that our county takes all allegations of child abuse and neglect seriously. That includes rapid and cross-agency responses to such allegations by the Department of Family and Children's Services, local law enforcement, the Child Advocacy Center, and the district attorney. In addition, the California Department of Social Services has a complaint page which provides guidance on the various avenues by which someone can make a child welfare-related complaint. Thank you.
Thank you very much. Let me just confirm with the clerk, we have no other speakers at this point?
That's correct.
All right, thank you very much. That means we'll move on to item number 3, which is to approve the consent calendar. Supervisor Lee, we have items 16 through 22 recommended for consent. Can I get a motion to recommend approval of the consent calendar?
moved.
Motion by Lee, second by Semidian. Anyone wishing to speak on consent?
No requests.
Then call the roll.
Vice Chairperson Lee?
Aye.
Chairperson Semidian?
Aye. Motion carries unanimously. Consent calendar is approved. Thank you. That takes us to item number 4, which is to consider recommendations relating to medical staff and allied health professionals at our Santa Clara Valley Medical Center, O'Connor Hospital, and St. Louis Regional Hospital. We have 4A, B, and C, and D as possible actions. Can we get a motion from Supervisor Lee and a second by Supervisor Semidian? And here to present today is
Patricia Salmon, Enterprise President of the Medical Staff of Santa Clara Valley Healthcare.
welcome and thank you. Any comments or questions before we move to a vote on the item? Madam Clerk, anyone wishing to speak on this item?
I have no requests.
Call the roll.
Vice Chair-
Second.
Sorry, I thought I missed that while I was. Vice Chairperson Lee?
Aye.
Chairperson Semidian?
Aye. And for the record, that was motion by Lee, second by Semidian. Is that correct, Madam Clerk?
That's what I have.
Your mission is accomplished. Thank you very much.
Thank you.
Takes us to item number 5, which is to receive a report from the Public Health Officer relating to COVID-19. And I believe Dr. Rudman's with us today, yes?
That's right. Good afternoon. Thank you, Chairperson Semidian, Vice Chair Lee, Sarah Rudman for the Public Health Department. And I have just a few brief updates on COVID-19 and other winter respiratory viruses. So to start us off, I'll share that after quite a prolonged period of quite high wastewater levels of COVID-19 across really all 4 sewer sheds in the Santa Clara County, we are finally seeing all 4 head quite steadily in the right direction, head downwards, such that we're now in medium levels for San Jose and Palo Alto and low levels in Sunnyvale and Gilroy. So it does appear that the quite prolonged, quite high levels of COVID transmission we experienced in the late summer are all headed in the right direction. Fortunately, during that period, while we did see an increase in COVID-related deaths and COVID-related hospitalizations, this was nowhere near as severe as we saw this past winter. And so the overall trend of despite a lot of disease, there is not a lot of severe illness or death, continues year over year, wave over wave. Likewise, we are still in the period of low RSV activity all over the county and low influenza activity all over the county, with a short-lived peak in Palo Alto of influenza A activity that has come back down. Some investigation here didn't find any concerning activity, specific outbreaks to blame, or anything that concerned us in terms of overall access to healthcare related to influenza A. But in addition to improving trends in wastewater, the other thing we know is coming that is also a good sign for the fall and winter is that our new flu and COVID respiratory virus dashboard makes it easier than ever for Santa Clara County residents to get the information they need in the language they speak, ideally, about what's happening around the county with respect to these winter respiratory viruses. So the first time ever, we now have all 3 of these winter respiratory viruses combined on the same dashboard with easy to navigate information about what's going in the wastewater, the hospitals, et cetera. And not only is the content, sort of the text translated into Spanish and Vietnamese, but the actual dashboards are now available for the first time in Spanish and Vietnamese as well. Another very important update as we head into the winter is that it is time again for folks to receive their updated influenza and COVID vaccines, and for some folks to be vaccinated against RSV, or respiratory syncytial virus. So we have now seen FDA approval and CDC endorsement of this year's COVID-19 vaccine, as well as this year's flu vaccine. The flu vaccine this year contains 3 strains, and there are programs for both uninsured and underinsured youth through the Vaccines for Children and adults through the free state flu vaccine program. Now for COVID-19, the Fed did sunset the Bridge Access Program, or BAP, that was for underinsured and uninsured adults. So that program is no longer available this season. There is still a program that the Public Health Department supports for uninsured children to receive access to the COVID vaccine, but the best way for people who are not insured to get access to a free or very low-cost COVID vaccine this year is to get insurance. And so it's my colleagues at SCVH who are doing a great deal of work, and at SSA, to get people enrolled, especially now that there are expanded eligibilities for Medi-Cal. So we are continuing to put out information to folks to make sure they understand that the best way to get vaccinated for COVID-19 this year, as well as for flu, and you can do both in the same day, is to go to your usual doctor or your usual pharmacy if you have insurance, and if you don't have a usual doctor or don't have insurance, to contact the patient access line for access to enrollment in Medi-Cal. And then the RSV vaccine is recommended only for individuals 75 years and older for everyone, and for ages 60 to 74, folks are at increased risk of severe disease. And then there are no changes to the recommendations for vaccination in pregnant individuals or a type of shot that protects infants as well that became available for the first time last year. And then my last slide for you all today, and then happy to take any questions, is, I have 2 more. So the second to last is just to share a bit more about what the Public Health Department is doing to make sure that folks know that everyone 6 months and older should be getting an updated COVID and flu vaccine this fall. Make sure that folks are aware that it's out and available and know how to get it and how to get it affordably, especially if they're currently uninsured. So we're putting out marketing in multiple languages, doing community outreach, and supporting linkage to care. Now, my last update for all of you is about the H5N1 bird flu that some of you have been following, also referred to sometimes as highly pathogenic avian influenza, which just means bird flu that can make people really sick. So we know this type of bird flu has been circulating in wild birds all over the country, all over the world, including here in Santa Clara, for some time. What changed over the last several months was that it became detected in cattle herds, especially dairy cattle, and we'd been watching closely for it to hit us here in California. While we have no dairy cattle cases here in Santa Clara County, for the first time since our last Health and Hospital Committee, we are aware of cattle herds in California that have been impacted. These, I think, actually have been updated from 3 to now 4 Central Valley dairies. And the state health department, as well as the relevant local health departments and CDC, are closely monitoring the workers at these dairies and using all of the tools available to them to make sure that the spread of disease stops there. And so here in Santa Clara County, we're doing a number of things, such as monitoring wastewater, keeping an eye on all positive flu tests to make sure there's no of this unusual type of flu among humans here, and working closely with our dairy as well as poultry industry and our partners in the Department of Agriculture to make sure that our industries and their workers are staying safe and healthy here. Another thing we want to make sure folks are aware of is that because this is impacting dairy cattle and because bird flu can be found in the milk supply when it's coming from infected dairy cows, the safest thing to do is eat only or consume only pasteurized milk and pasteurized milk products. Not only is H5N1 a risk, but we also know that other diseases can be spread by raw milk or unpasteurized milk. And so we're doing some work to get that word out as well. So I will stop there, and I'm very happy to take any questions. Thank you.
Thank you very much. Let me first ask if we have any cards on this item. Any speakers?
We do not.
Thank you. Supervisor Lee.
Thank you, Dr. Redmond. Good to see you again. Certainly good news to see that the wastewater for, in this case, Gilbert and Sunnyvale has low numbers on the COVID, but certainly we still have some of it. And that's why it's exciting to see that the new COVID vaccine is now being approved by the FDA and is fairly widely available now, correct?
That's correct. Our understanding is that shipments have gone out and been received by all of the major providers in the county. But this is brand new, really hitting us this week. And so we expect widespread access in the coming weeks.
Great. And as far as the COVID vaccine is concerned, we are not doing any type of a sequencing, like say letting the elderly population to get it. Basically, everybody is now eligible and everybody can sign up for it. Is that correct?
That's correct. So the recommendation are that the benefits far outweigh the risks for everyone 6 months and older, and that there is enough supply and providers out there that everyone can go get their vaccine as soon as they're ready. And so I think the group we're most concerned about making sure that they hear that message and get the support they need, or anyone who doesn't have insurance. And so right now, the best path forward for those folks is to utilize some of the resources at hand to help them enroll in Medi-Cal so that they can access their vaccination that way.
There has been some other messages saying that if you have had COVID recently or have had the old vaccine a certain amount of time, you're not supposed to get a new vaccine. Does that still apply today?
That is still correct, and that may be especially relevant given how many people we know in Santa Clara County had COVID in the last several months. So the recommendation is that if you have had COVID in the last 12 weeks, you may want to wait until 12 full weeks have passed before your next COVID vaccine. Now, it's not dangerous to get vaccinated earlier, but the evidence seems to support that both your recent infection gives you some short-lived protection, so the vaccine is a little less necessary for you right after you've had COVID, and the vaccine may work best if you've waited around 12 weeks or longer since your last COVID vaccination. So again, the recommendation is aim for 12 weeks or longer after your last infection, but if you need to cheat a little bit earlier for your convenience, it's more important to be vaccinated at all.
Great. And the other question is the old COVID tests that we're so familiar with seeing, like from iHealth and the Orange Box and other brands, those COVID test kits still works for the latest strands for COVID and from detecting it, correct?
That's exactly right. Everything we're seeing tells us that the same sort of brands and manufacturing batches of the COVID vaccine that we've had access to now for several years continue to detect the current circulating strains of COVID at very high levels of what we call sensitivity and specificity. That means you can believe a positive test is real and a negative test is real. The only caveats are ones that we've had for a long time, which is if you've just gotten sick in the last day, your test may not yet turn positive, and so if you know you've been exposed or you're feeling quite ill, we recommend testing again a day later.
Okay, and then the other word is don't throw away the old test kits because they might still work fine, right?
That's exactly right. So those expiration dates that show up on the test kit are based on how long the company that made them proved that they still work. But there's no scientific reason they won't still work for months and years after that date. And so that's why if you've got a test kit, no matter how old it is at home, if you try to use that test and the control line still shows up, that's the line next to the letter C. If that line appears, your test worked, and you can believe the line next to the letter T. If it's positive, you probably have COVID. If it's negative, you probably don't.
All right, that's all I have. Thank you very much, Dr.
Thank you.
Brennan.
Thank you. Doctor, let me ask, the newspapers have been covering the emergence of XEC as a variant. A lot of emphasis on Europe, although clearly identified here in the United States as well. We've talked in this committee in the past about the fact that the vaccines are ever evolving in an effort to be maximally effective against emerging variants. Where are we? So if we send folks off, or if they go off to get a vaccine this fall, and it will be the latest, up-to-datest vaccine, is it formulated to address XEC or not? Do we know?
So our best information right now is that the current vaccine that's just become available in the last week or even days is the best match to what's circulating not only around the US and here in Santa Clara County, but around the world. And part of the reason for this is we've actually seen sort of a narrowing of how different the virus looks from each other. We used to see one variant to another looked radically different, such that the very old tests we had might not work the same. The very old vaccines we had might not work as well. Now we're seeing much smaller changes type to type. And so in general, the newest vaccine is still the best protection of both the things that are circulating right now and the things we think we see on the horizon. That said, the proof of that alignment always comes months later into the year. We start to see things like in a test tube in a laboratory, how well do these match? Or in a mouse, how well do these match? And then sometimes months after a new variant hits us, we can say, how well did the vaccine really work? What we saw last year was that even though by exact description of the variants, what was in the vaccine wasn't exactly what was circulating, we still found that the vaccine was excellent protection against what was around. And our best information right now is that we anticipate seeing the same thing again this year. So that's why I feel very confident making the recommendation to go ahead out and get vaccinated with the new version.
Thank you. Sort of some similar questions just to sort of make sure that we're up to date here. I want to make sure that the inference I drew a minute ago from something you said was a correct one. You talked about how long people could wait to get the vaccine if they had recently had COVID. Did I correctly infer from that if they had COVID a year and a half, 2 years ago, that probably wasn't going to protect them from getting COVID again?
That's exactly right. It does appear that the protection one gets from a COVID vaccine, from an incidence of being sick with COVID, wanes fairly quickly. There is some levels of long-lived protection in certain types of your immune system, parts of your immune system, but overall, if it's been 12 weeks or more since the last time you had COVID, the benefits of getting vaccinated strongly outweigh any risks, and we definitely recommend folks get vaccinated.
And then what do we say to the folks who we encounter from time to time who say, you know, I had the vaccine 3 months ago and I got COVID anyway?
So we do know that the vaccine isn't perfect. It will not 100% prevent cases of COVID. What it will do is significantly reduce your risk of dying from your COVID or becoming severely ill. There's also emerging evidence, as this body addressed in the special meeting in August, that vaccination also reduces the risk of long COVID and other more serious complications other than those that can occur right at the time you first get sick. So for all of these reasons, even if you are one of those unfortunate folks who gets COVID even after a vaccination, you likely had a much milder version than you would have had. You may be less likely to spread it to others, and you're much less likely to develop severe complications from that infection.
Is there a plain English layperson's explanation for why you are less likely to spread COVID? And I'll put Mr. Lorenz in the hot seat on this one. So, doctor, you're sitting there. If you had COVID, but you had recently been vaccinated, I understood you just now to say you're less likely to give it to Paul, who's seated next to you. Did I get that
I will.
right?
I see him edging away from me, but this is why he should be confident.
And why would that be?
Sure, 3 reasons. So one is I'm less likely to get COVID, and I'm not at all likely to spread it to him if I don't have it. But even if I do, I may be contagious for a shorter period of time, and I may be less contagious in that the amount of COVID coming out of me as I'm sick may be
Excuse
less.
the interruption, is this the shedding word?
This is the shedding, yes. I was trying to follow your instruction, use
No,
lay
thank
terms,
you. I
but
just,
yes.
I'm, trying to remember what I remember. Okay.
That's right. So we refer to that as shedding, where when I'm sick with a virus, especially right after the very first day of it, I start to have those same virus particles coming out of my nose every time I cough, every time I speak, when I rub my eyes. So that's what we mean when we say shedding. And I'm shedding for a shorter period of time. So Paul might hang out with me on a day when I'm not shedding or an hour when I'm not shedding at all. And when I am shedding, I may be shedding less. There may be less virus coming out of me and not enough to make him sick. And then finally, if I'm less sick, especially if I've gotten a vaccine that has kept me from having severe complications like a prolonged cough or a severe illness, I might be less likely to do things that spread the virus around. I may be less likely to cough on Paul. I may be less likely to throw up, although I hopefully wouldn't be doing that in chambers if I were that ill. So for all those reasons, we know that vaccination makes somebody not only less likely to get sick, but less likely to spread COVID.
Got it. And what's the, now that we have had time pass since Paxlovid arrived on the scene, what's the current thinking, or your office's current thinking about the efficacy or not of Paxlovid?
So the best evidence still tells us that Paxlovid, the benefits outweigh the risks for a majority of patients who get COVID who are 50 years and older, and a subset who are 40 years and older, and maybe those who are even younger if they have certain immune conditions or other co-occurring health conditions. So it is worth it, and one needs a prescription, so a conversation with a doctor or pharmacist to get that Paxlovid. But for those populations, the benefits far outweigh the risks. And the benefits are preventing death, preventing hospitalization, preventing severe illness, and some complications.
And I don't know if this is in your purview, but is my recollection correct that it's a fairly pricey drug if you're uninsured?
I'd have to look into it. I do know that our own Better Health Pharmacy can assist with uninsured persons who need to access the medication. They have a test-to-treat program, which means you don't even need an intervening doctor. You can take a rapid test and get access to Paxlovid for free. But in addition, insurance should be covering it in full. I'm happy to get back to you with the exact price details as well.
Not necessary. Thank you very much. I have no additional questions. Anything else you want to share now that we've been poking and prodding at your report?
No, nothing, thank you.
Supervisor Lee, all good?
Yes, I just want to follow up the very last point regarding Paxlovid. When I was in Canada past year, not one but both my parents caught it visiting relatives, and not having Canadian insurance. Surprisingly, I was able to get both of them Paxlovid basically same day for free. And they figured out that we are not insured in the country. And so I was very grateful for the country of Canada dispensing that, but I just want to make sure that we also were able to provide the same to our residents. Thank you.
Thank you. All right. We had no speakers on this item,
That's correct.
and we will simply ask for a motion to receive the report.
So moved.
Motion by Lee, second by Simidian. Please call the roll.
Vice Chairperson Lee,
Aye.
Chairperson Simidian,
Aye. Motion carries unanimously. The report is received. Thank you again, Doctor. All right, that takes us to item 6, diabetes prevention. Who's reporting on this item? Back to you.
You've got me again. So Public Health Department is pleased to present this report describing our diabetes prevention strategies recognized in our Prevention and Wellness Program Strategic Plan, and specifically which strategies we're prioritizing with the resources in the Public Health Department. So I have with me my colleague, Gabriela Camberos, who's a Program Manager 3 for our Clinic to Community Linkages team, which includes the diabetes prevention work in our Healthy Communities branch. And we are here to answer any of your questions.
Thank you, Dr. Redmond. Supervisor Lee, I know this was a particular interest of yours. Would you like to begin with questions or comments, if any?
Let's open the public hearing. If there's no more, I'll go ahead and ask.
All right.
I have no cards in chambers, no hands in Zoom.
So we have no speakers on the item. And let me just ask, Dr. Redmond, thank you again. Could you please put your mic on and tell us your last name again? I got the Gabriela, but I didn't get the last name. I apologize.
Yeah, no worries. It's Camberos.
please spell.
Camberos.
Camberos. Thank you very much. All right, Supervisor Lee, anything?
Yes, thank you. Good afternoon. I would like to first thank you so much for the report and want to follow up with you regarding any potential existing funds or grant opportunities to help fund the implementation of some of the strategies mentioned in the report, specifically Strategy 1, Strategy 2, Strategy 3, and Strategy 6.
Yeah, let Ms. Camberos jump in. I think in general, we are actively seeking for additional resources that may be out there, but have not seen significant opportunities on the horizon, to my knowledge. Gabrielle, anything you would add?
Yeah, that's correct. So we are waiting on a CDC grant that we submitted with a research partner, and that would be specifically for Strategy 6, which is our clinic to community linkages strategy. And we're also actively collaborating with a faculty member at Stanford who is looking at funding for screening, specifically screening in non-traditional settings, but nothing has yet formally panned out.
Okay. If there's less than $5 million in funding found to fund these 4 strategies, in what order would you fund these items first, would you say?
Yeah, so we had some time to think about prioritization, and we'd first prioritize screening with follow-up, just given that it's been quite a few years since in the county we've done any kind of universal screening. Our partners, our clinical partners, are always following screening guidelines, but we'd like to be able to screen wider and be able to detect diabetes earlier or prediabetes earlier. So that's our first priority where we'd request funding. And then the second one is really the community health worker strategy that we have in our plan. And that is really because we feel that it has a lot of potential for return on investment and being able to have a sustainable way of paying for the community health workers through Medi-Cal.
Yeah, as we know, if we do your health assessment or do your blood panel, the A1C test is the one that is one of the earliest indications of whether or not somebody might be suffering from diabetes or pre-diabetes, and I learned that myself the hard way, and so certainly want to promote that that test being so important, and certainly has changed the way I have lived my life and choose what not to eat and be more careful day to day. Also like to see if we could ask the administration to come back to us in the future HXC meeting with the funding opportunities for these strategies 1, 2, 3, and 6 as well, along with this potential grant. But if we don't get it, how can we potentially find other ways to do it? As we know, the diabetes and pre-diabetes does affect too many county residents, and it's a very personal issue to me, and I would like to work with administration to ensure that we're able to implement all these diabetes prevention strategies indicated in this report. Thank you very much.
And Madam Clerk, what I heard was a request from Supervisor Lee for staff to come back with its thinking on funding strategies for these approaches. Let me just ask our county executive and or his team, would that best be accomplished with an off-agenda report or with a report back to this committee or at mid-year budget? And after we hear from you, we'll ask Supervisor Lee what his preference would be.
I mean, I think it probably makes the most sense to start with an off-agenda report and provide that information, and then it's probably a conversation that can be taken up at mid-year in the context of planning associated with the upcoming fiscal year's budget, which, as the board is aware, is going to be another tight budget. So it's a question of identifying, what non-general fund options might be available in this space.
Got it. Supervisor Lee, would it be acceptable to you if we had a motion to receive the report, which I would happily second, and with direction for an off-agenda report and follow up at mid-year, and that would give you some time, you and your office some time to work with administration based on what you get in the off-agenda report, yes?
That's exactly right. Thank you, and so moved.
All right, motion by Lee, second by Simitian, clear for the clerk, nodding and smiling, I'm hoping. We got nodding and smiling, that's good. And No speakers on this item.
Correct.
All right, then let's say thank you to our folks at Public Health. Pleasure to have you with us, and call the roll.
Vice Chairperson Lee?
Aye.
Chairperson Simidian?
Aye. Motion carries unanimously. Thank you very much. That takes us, I believe, to item number 7. This is the Alcove agreements. Who's presenting on this one?
Yes, good afternoon, Chair Simidian and Supervisor Lee. Sherry Terrell with our Behavioral Health Services Department. And we have Zelia Fria Costa, our executive over Children, Youth, and Families, and Megan Wheelahan, our county counsel, here to answer any questions related to the Alcove agreements.
Thank you very much. And let me say first, we've had a Supervisor Lee, just so you know, we've had one of the, as you might imagine, one of the things I'm trying to parse here in my last 3-4 months on the board is where do I put my time, effort, and energy? And frankly, what can I leave to you when we get to 2025? And one of the things I'm trying to put some of my office's time and effort and energy into is publicizing Alcove. And Mr. Williams, this is meant not as a criticism, but just as a sort of a matter of fact observation. I think, I know you and the rest of the team have heard from some of us on the Board of Supervisors through the years that we have so many parts of the organization that do such good work, but bragging on their good work or telling the community about it, doing the outreach, may not be their expertise. And so, I have the opportunity through my office to try and help the Alcove Palo Alto location in my district spread the word more broadly, because I think there's some very good work being done there. Thank you very much for being with us for 2 open houses. We pulled elected officials in, but it has been clear to me as I've talked with folks in my community, communities plural, in my district, that there's a lot of room for improvement, both in terms of outreach to the general public who might benefit from using the services, and also to elected officials and community leaders who you would hope and expect would know, but clearly don't. So we've been doing some outreach work. I want to just say thank you again to the folks at Alcove for the good work. We're pursuing that. As part of that activity, we discovered that there was one last document that needed to be signed, and so I, of course, have been exhorting, that's my polite word for it, folks to get the document signed. The status of that document as of today is, somebody help me?
Am I on? Yeah, hi. Megan Wheelahan from the Office of the County Council. The Business Associate Agreement is the last sort of trailing end of the agreement with the Mental Health Services Oversight and Accountability Commission to operate for pieces of the Alcove operation. And it's been executed by Stanford, signed by myself, and is making its way through county administration. So we expect that to be finalized by Thursday.
If it's been, I gather, signed by you as approved as to form and legality, and signed off on by folks at Stanford, what's the remaining signature that's needed by Thursday?
Probably folks that are in this meeting today, yeah.
Okay, so.
That was as of this morning, so there's no delay on anyone's part. Yeah.
Okay. Could we get an off-agenda notice when all documents have been signed, please?
I'm assuming, am I the last signature on that document?
You are, yes.
Okay. It's not in my queue yet.
It's not.
How about I let you know when I've signed it,
Great, that'd be swell, thank you.
instead of an off-agenda memo?
Thank you, we don't need thank you. A simple carrier pigeon will do, thank you. And thank you for that, and when that happens, looking to both legal and departmental staff, do we have everything we need to sort of continue the relationship and the collaboration in the years ahead?
Yes, it's my understanding Stanford has a contract with the MHSOAC to provide technical assistance to Alcove. That's been in place for some time. But I think once the BAA is in place, they would be comfortable providing that technical assistance again. And
I'll say to the behavioral health team, keep keep asking my office right up until December 31st for any help we can provide in the way of outreach, because the services are only as good as the awareness that they're available. And then, whatever happened, where do things stand? What's the future look like, forgive me for rambling, with the San Jose effort, which I know we had an Alcove San Jose. As I understand it, there were many challenges with the location. It's been relocated. The nature and structure of the relocated site is such that it doesn't technically constitute an alcove because there's literally a driveway somebody has to cross to access services, and I understand the conceptual underpinnings of that, I think. But are we gonna, has the decision essentially been made administratively to kind of let that work, or to continue to pursue a model that would actually put the Alcove brand on it? Where does all that sit and stand? I want to make sure that the services are available to the broadest swath of teens and young adults that we can possibly get them to.
Good afternoon, supervisors. The Alcove San Jose, well, when it closed back in 2021, we had to pivot very quickly because we were serving youth through the Alcove San Jose. So we did open the Downtown Youth Wellness Center, which is in the same catchment area as the initial location for Alcove San Jose. So that's been a very active wellness center. We see lots of youth there. And then subsequent to that, we have also been prioritizing our wellness center, our school-based wellness center grant program. And there were 9 high schools in the High School Union School District that were awarded. So we have sufficient capacity to provide not the same, but similar services to the Alcove Palo Alto, which really was intended to be an access point for youth to receive services. So that's where we are right now. We are not pursuing an Alcove San Jose at this point, given that we have been prioritizing other funds and services in that area.
Thank you. And Ms. Ferricosta, I know you know, and Mr. Williams, I think you have had occasion to observe, I am not typically one who focuses on, first in the state, first in the nation. But as I understand it, our alcove in Palo Alto is the first alcove anywhere in the United States. Am I correct in my recollection?
Yes, that would be correct.
And as I've said before, it's not a surprise. I'm a fan of the model. I believe in the model, but I'm mostly concerned that by any name and under any structure or configuration, we get the services to teens and young adults who need the services. So, Mr. Williams, thank you. I will wait with bated breath to hear from you that the last signature has been obtained, and I know you got a.
Well, I can provide you an update.
Well, boy, that pigeon flew fast, man. So.
Yeah, the agreement came into my DocuSign queue about 20 minutes ago and is now fully executed.
There you go. Thank you. Wonders of modern technology. Appreciate it. All right. We're going to declare success and take yes for an answer and any other cliche I can trot out at this hour. All right. Thank you all very much. And truly, behavioral health, do let my office and me know if we can provide anything in the way of outreach during these last few months of the calendar year. All right. Thank you very much. We need to check and make sure. Do we have speakers on this item?
I have no request to speak.
All right. Can we get a motion to receive the report?
Motion to receive report and a quick comment.
Please.
Yes, sir.
I'll second, by the way, and then go right ahead.
Thank you. First, I want to thank the Behavioral Health BHSD for answering our questions before this meeting today. And certainly want to reaffirm to our county administration and the public to know that I certainly fully support this alcove model. It's something innovative and different from how we serve young youth and young adults. We certainly need to work towards improving the outreach in reimbursement sustainability for all the alcove services, and that the future of healthcare services do depend on trial and error with newer models like alcove and less like the standard healthcare models we have today. So I certainly look forward to having Stanford back to provide the technical assistance, and would like to make a request to invite in the future the Stanford representative, the Alum Rock Counseling Center representative, and the Youth Advisory Group representative to attend future ALCOV reports at the HHC meetings moving forward, as these representatives should be able to bring in more insight directly on their work of how we could continue to improve this program. Thank you.
Staff have a reaction before we vote on the motion?
That would be fine.
Okay, great. Thank you so much, Chair.
All right, well then, without objection, hearing none, we will incorporate the request into the motion, Madam Clerk. And if you need clarifying language, I'm sure that the supervisor would be happy to provide it immediately upon conclusion. Call the roll on the motion to receive the report and make the request.
Vice Chairperson Lee?
Aye.
Chairperson Simidian?
Aye. Motion carries unanimously. Thank you again. Bless you.
Excuse me.
And Hospital Committee meeting in June, you did request that administration report back on the status of the program and really on ways in which we can further improve the program. You have invested a significant amount of time in this program, and so has the health system. So there's three things that we're looking to do. One is that we're looking to really focus the program in our community on those that are not enrolled in the government-sponsored programs such as Medi-Cal and Medicare. This will allow us to focus on those that would most benefit from the program. And this population we're speaking of is the missing middle, which, as you recall, is really the full intent of the program, is to support those in our community that are having difficulty in obtaining medications that they would benefit from a health perspective. We are going to strengthen and improve our ongoing eligibility criteria and review process. And we will once again be launching a community-wide outreach program to target the potential eligible individuals in our community so that we can reach the enrollment of 2,500. And as you will recall, we were at 2,000 enrollees, and your board approved another 500 with support of the county executive office. So our goal is to reach another 2,500 in terms of a level of enrollment as quickly as we can over the course of the next several months. And that target will be reached by the end of 2025 at the very latest. And obviously, I think, Supervisor, our goal is to get there much sooner than later.
And that was 2025 as in next calendar year, yes?
Yes.
Thank you.
So with that being said, Dr. Nari Singh is here along with myself to answer any questions.
Thank you. Dr. Singh, welcome. Thank you. Thank you to both you and Mr. Lorenz. And please convey certainly my thanks to all of your team for standing up the program to date and the success that the program has had to date. Supervisor Lee, I've got a couple of comments. If you'll forgive me, I'll wade in. I just want to say it because I want it on the record. And I don't think there's anything wrong with saying publicly. We had some conversation or recommendations at, I think it was that meeting in June that you referenced, and about the potential for moving the program over to SSA, Social Services, and I expressed a very strong concern at the time, reservations, and you know, that possibility, as I understood it, was a function of the fact that there were concerns about the legal structure of the program, and you know, obviously I don't want to get into that too much, but I'm going to return to it in a minute. And my concern, and there was a little bit of a catch-22, because my concern at the time was that the legal argument was advanced that the legal concerns could be ameliorated, if not altogether eliminated, by having someone outside the health and hospital system administer the program. And of course, the catch-22 was, so if we have folks who are less familiar with the benefits of the Medisys program administer the Medisys program, then we are less at risk legally. which I didn't find a particularly compelling argument. I wanted the Medisys program to rest with the people who actually understand the benefits of the Medisys program, and I believe that's the current case. So I'm glad that we have pivoted and found a way to make sure that continues to happen. I do just want to look to County Counsel's office and say, I have read the confidential memo very carefully, word by word, line by line, and for the lawyers in the room who remember book briefing from their law school days, I have book briefed it pretty carefully. And I just want to politely say I was not persuaded. So I'm a little frustrated that we've had this exercise because I was not persuaded that there was an issue there. And I understand that it is the job of our county counsel's office to keep our organization out of trouble. On the other hand, I don't like looking for trouble if I don't think there's any trouble really there. And it's rare that I lean in and just say, I'm sorry, I have a different opinion. And I'd be the very first to say, I have no background or expertise in this particular set of issues that were raised. But just as I read the analysis, I looked at words like may be more inclined or could influence and thought that doesn't sound like a very compelling argument to me. So that's one person's read. Having said that, I want to end on a happier note, which is that I think the expression of concern was heard and well responded to. And I'm going to put Mr. Lorenz on the spot a little bit here, if I may. So if we leave the program where it is, restructure it as suggested in item number 8, beginning at packet page 68, we anticipate that there will be some initial loss of participation because some folks who have been eligible will no longer be eligible. But that will then free up, given our limited resources, that will then free up the opportunity for other folks who are not currently the beneficiary of publicly funded health coverage to participate. And the commitment from you, Mr. Lorenz, is to hit that 2,500 target by the end of the coming calendar year. Did I get all that right?
That is correct, Supervisor.
All right. Well, then, in a minute, I'll ask Supervisor Lee if he has a motion to receive the report. And will this be going to the full board, or does this get done administratively at this point?
This would just get done administratively, and if I could just add one other piece, I think, we always try to look at how we can make challenges into opportunities. And I think actually this is a good example of that because we have the opportunity now to actually make sure that the full set of folks enrolled in the program are really the target population that was originally envisioned by your referral, and folks who otherwise would not have the benefit or access to our absolutely extraordinary resources through our pharmacy, which is just incredible. And the folks who will no longer be eligible, fortunately, already have that access to our pharmacy staff. So if you think about it from that perspective, it's actually, I think, at the end of the day, a good improvement in the program. So not, just sharing that perspective that I think where we're landing is a really positive place.
Thank you. And in a different and better world, which is to say a world none of us get to work in, we might have a federal and state regulatory environment that allowed us to actually provide the medications that we're talking about rather than use a financial subsidy, which is, in my estimation, kind of a second best. But it's the best we can do with the environment we're obliged to work in, and fair enough. Thank you, Mr. Williams. Supervisor Lee?
Yes, I do have a couple of questions on this one.
Please.
One is regarding the outreach to the HAP enrollees. That outreach seems fairly straightforward, and just want to check to see how does administration intend to reach individuals with the higher deductibles and other out-of-pocket prescription expenses that are not in the Medi-Cal and Medicare program now?
Supervisor Lee, so I think first of all, when we do these outreach campaigns and work with our marketing firm, we really try to narrow our target audience to the individuals in our community that we know would be eligible. So we would work with other community health organizations and community organizations that serve this population and provide that outreach directly to that population. And that has been proven to be rather effective. And I think, Supervisor, you will recall that when we launched a campaign, we saw an immediate increase in enrollment in a very short period of time because of that effective target campaign that we undertake.
Thank you. So I would hope to, in my motion, to approve to receive report, I'd like to also ask the administration to provide us the monthly medicines program reports, HHC, for the foreseeable future. That's separate from the SEVH monthly operations report. Is that doable?
Excuse me, Supervisor Lee, I just had trouble with the speaker system. You wanted those reports at which
Yeah, just getting back to us for our monthly HHC.
HHC, thank
Yes,
you.
correct.
Supervisor, if I may clarify, so we will be more than happy in our operations report to provide that regular update, a brief update on our progress. That's something we're happy to do.
Okay, great. Thank you.
And gentlemen, just to make sure that nothing gets lost here in the shuffle, I think, Mr. Lorenz, what I'm hearing is a request that the marketing report get called out specifically and publicly, orally as well as in writing, even if nobody in this committee asks you about it at the meeting. Is that doable?
Yeah, if I may clarify.
Please.
My understanding of the request is that in our standing operations report from the Santa Clara Valley Healthcare System, that we will provide a written update. And if your committee so chooses to have further discussion regarding our report, we're happy to do that in our ops report.
No, and forgive me, and thank you for asking. I know you're
Okay.
trying to make sure that you know what you're being asked of. So for those who are watching, we're not arguing, we're clarifying. Supervisor Lee, it is ultimately your request, but I just want to be clear. So for example, the Public Health Department at various times has said, should we stop giving you a COVID report out loud? And I have at various times as the chair of the committee taken the prerogative to say, no, thank you. I want to continue to hear it because I worry that people have COVID fatigue and would just as soon pretend that the issue's gone away, and it hasn't gone away, and it continues to be a public health threat in my estimation, which I believe is borne out by the reports we get. So I keep saying, I know everybody's tired of it, but let's have the report. So on this item, to bring it back to this one, yes, we get the written report, but even if the two people who are sitting here, and come January, those will be could be two different people, don't lean in and ask, the request/direction is, as part of your oral report, that rather than say everything's in there, that you will be expected to offer up the marketing report as we expect Dr. Rudman or Dr. Cody to lean in and say, hey, here are some slides, have a look, this is what's going on with COVID. Was that a little clearer?
That is clear.
And is that consistent with your expectation, Supervisor Lee? Okay, good. Thank you.
Thank you.
Supervisor Lee, I appreciate you letting me get my way on your motion, so thank you for that. We have a motion by Supervisor Lee and a second by Supervisor Simidian. Do we have anybody who wants to speak on this item?
We do not.
Thank you. And Mr. Lorenz and Nari Singh, please do take the thank you back to all the folks who've worked hard to stand this program up and make it a success. It is, in my view, it's one of the sort of better examples of board members come up with bright ideas, but they only work if the capable staff and the organization make them work, and that's very much the case in this instance, so thank you. Please call the roll.
Vice Chairperson Lee?
Aye.
Chairperson Simidian?
Aye. Motion carries unanimously. Thank you both. Appreciate it. All right, and thank County Council for walking the path toward a workable solution. Appreciate that. That takes us to item number 9, mobile dental services for veterans. Who's reporting on this one?
Thank you, Supervisor. Just a real quick brief update, then I'll turn it over to Celine Ho to answer any specific questions. But we're pleased to report, as a report back from your request and Supervisor Lee's request, that we find a way to work with Veteran Services Office to provide mobile dental services on a regular basis. We have engaged in a contract with Mobile Dental to provide for that service on behalf of the health system. We'll be coordinating those services to ensure that individuals understand the full spectrum of dental services available within the health system. So it is a way to outreach and provide initial services and support, but also in a manner that's integrated into our health system. So we're pleased to report that contract is about complete, and we fully expect that on October 2nd through the 4th, that we will provide that service at the stand-down event. And that will be the first of many events and locations for which we will provide this important service to our veterans. So with that, I'm happy to answer questions along with Celine Ho.
Thank you. So welcome, and thank you to you all. My view is this is responsive to the requests and/or directions that I have brought forward, but let me turn to Supervisor Lee because he and I have been partners on this effort.
Good afternoon, Celine. Thanks for the report, and glad to see this thing moving forward nicely. So a couple of questions to follow up on this is, how much do you think is the cost for the mobile dental to serve at the stand-down event, and how much do you think will be remaining for them to provide services for the rest of the fiscal year?
Yeah, we had started this agreement to do the stand-down event and then to provide the clinical, the mobile dental twice a month. We do anticipate that we will run out of the funding before the end of the contract term. However, we do intend to include it in the budget for the next fiscal year.
Okay, and how often will the VSO in South Santa Clara Valley Memorial District Gilroy Veterans Memorial Hall host these for the fiscal year? You mentioned approximately 2 times a month?
Correct. Currently, under the contract, it's twice a month.
Okay. Are these services potentially reimbursable through the Denticare or any other programs we might be able to ask for?
Yeah, for this dental provider, it is not reimbursable under Dental Cal.
And if I may, Supervisor, just add on, and the reason is that they're not a Dental provider, but on top of it, it's unclear at the time of the service whether the individual qualifies for another program. They are veterans, so there are some limited benefits. Our hope is that connecting that individual with our health system for ongoing care and support will allow us to provide that service and get reimbursed where possible. So that's the importance of linking the dental program with our fixed site locations in terms of supporting the veterans.
So, Paul, what you're saying, let me see if I understand, is that as far as we know right now, they are not reimbursable, but once we get the service started, working with VA and other agencies, we may be able to get this reimbursable in the future?
Only if those services are provided in our facilities. The mobile dental service is not. At some future date, if we as a county expand our dental services and are able to serve those locations, then it would be reimbursable.
I see. So maybe we could get them through the mobile dental service and say, hey, come to our fixed services offered by the county in the future, and that's how we could get them into our system to make this a reimbursable services moving forward.
That is correct, and that is our approach in terms of working with this contractor and with the VSO.
So this is more like an outreach program while we're providing services at the same time recruiting them into our services.
That is correct.
Got it. Great. And in terms of the sustainability of funding, beyond this fiscal year? Is any plan that we could do to try to make sure that this is truly a sustainable program in the future?
Yes, I think during the course of the next 12 to 18 months, we will find ways in which we can sustain the program. If we continue to do the outreach, which I believe is the direction, we can seek other grants or other supported avenues.
Great. That's all I have. Thank you, Paul.
Do we have any speakers on this item?
We do not.
Supervisor Lee, can we get a motion to
Yes,
receive
so
the
moved.
report? Motion by Lee, second by Semidian. Let's call the roll. Thank Ms. Ho.
Vice Chairperson Lee,
Aye.
Chairperson Semidian.
Aye. Motion carries unanimously. Thank you both, and thank you for the effort. All right, that takes us to item number 10, which is the Santa Clara Valley Healthcare Diagnostic Imaging Department's report relating to mammogram equipment replacement and upgrades and the timeline.
Thank you, Chair Simidian. First of all, I'd like to introduce Dr. Praveen Anchala. He is our Director of Diagnostic Imaging for our health system. As you recall, earlier this year you did request a periodic update, the first being this fall, around the status of a diagnostic imaging equipment related to early detection of breast cancer. So we're happy to take any questions. I'm not sure if Dr. Anchala, you have anything else to add?
Doctor, could you do me the favor of repeating your name and spelling it again? And I apologize for the request for spelling, but the speakers seem a little fuzzy today, and I just want to make sure I'm pronouncing your name correctly when I refer to you.
Praveen Anchala, Praveenanchaala. And thank you for
A-N-C-H-A-L-A.
Yeah.
Anchala.
Got it.
Thank you very much. All right, Doctor. I want to ask just by way of review, you know, this is an area, as I think you have observed, of interest and some prior work on my part. And one of the things that's fascinating about it is that the technology has changed over time. And so if I were to ask, what's the sort of range of tools available these days for diagnostic imaging? Start me, if you would, start us at the most basic level and describe what that is and the pros and cons, and then sort of take it up a notch, because that I think will help make a little more sense of the conversation about where we are and where we're headed.
Sure, no problem. First, thanks for having me here. I'd love to answer that question. First, the most basic service we offer was kind of what we use for everybody, would be a screening mammogram. So it's essentially an X-ray of the breast tissue to look for and detect cancer, and that's done on a routine basis as a screening test. So mammogram is sort of where we start. There's more targeted evaluations, such as ultrasound, if a patient has something that's palpable that they want to evaluate, or there's something that's picked up on a mammogram that needs further evaluation with ultrasound. So those tend to be our initial sort of steps. Part of a screening mammography lately has been our breast tomosynthesis, which is what a lot of what this specific report is centered around. And that's essentially a technology that's been developed and it's merely come into favor more recently, that allows us to sort of move through the breast tissue in a more three-dimensional or sliced way. So it gives us a little bit of a better sense of what's happening within the tissue. And so that increases our ability to detect specific types of cancer. From there, pretty much the main sort of highest technology service that we offer in mammography is our MRI. And that's used predominantly as a troubleshooting mechanism, or in someone who has diagnosed cancer to really fully stage the patient.
Thank you. When we're talking about what I'm going to call, and please correct me if I use language that's incorrect or misleading. Seriously, just lean in and correct me. The term, I'm going to call it conventional mammography. Is that a fair enough term for the starting point?
Sure, yeah.
And is that when you use the word X-ray, I sometimes hear that referred to as film, yes? Film, F-I-L-M.
Yeah, film before the advent of our sort of multi-detector, sort of DR imaging was what the mainstay was. So that's kind of what you see in TV shows where they print out the image.
And
Now-
DR stands for?
Digital.
Okay.
Digital radiograph.
So is digital mammography and tomosynthesis different, the same?
Yeah, they're different. They go hand in hand these days, like what we're trying to move towards with this report. But we've been doing digital mammography for a while. That's been probably standard of care across the country, and we've been doing that here for a long time. Tomosynthesis is sort of a newer thing that's really been catching on, particularly in this area. And that allows us to sort of like scroll through the breast tissue in a more three-dimensional way. But the underlying technology is similar in that it uses an X-ray beam.
If I went out and looked at every piece of machinery that is used for breast imaging in Santa Clara County, or in the Santa Clara Valley, healthcare system, I don't know whether that's 20 or 50 or 100, but what percentage of them are still what I'm going to call conventional mammography using X-rays?
It's a difficult question to ask. I would say within our peninsula area of the county, including most of our major other hospitals, it would probably be somewhere between 50 to 75%. And as you kind of move away from urban centers, those numbers tend to drop off in terms of tomosynthesis.
Is it a knowable number for the county's Santa Clara Valley healthcare system?
Oh, for us? Yeah. Yeah, we have two currently, and we're looking to replace essentially all of our, a majority of our equipment soon with that process, which I believe is part of this report.
Right. And then that takes us to the fact that, as you indicated a minute ago, if I understood you correctly, digital mammography, 3D,
yeah, right.
has significantly replaced what I'm going to call conventional mammography? Yes, no, maybe?
Yeah, I guess just a little bit of a point of clarification.
Please.
The digital mammography is essentially what you were referring to earlier, in that the mammogram is not viewed on a film anymore. It's actually viewed on a computer. Digital tomosynthesis is that next step that you're referring to, where it's quote unquote the kind of 3D view, which is sort of the colloquial expression when we're discussing tomosynthesis.
Am I confusing or conflating? So would it be more accurate or more precise of me to say that the conventional mammography has been, the technology has evolved and has slowly but steadily been replaced by digital mammography? Would that be a better way to say it?
Yeah, that's a perfect way of saying it.
Okay. And then, in addition, it sounds like separate from, in addition to that technology, we now have the benefit of tomosynthesis, yes?
Correct.
And then in addition to that technology, we have the benefit of ultrasound where called for and appropriate, yes?
Yes.
And in some instances, MRI, yes?
Yeah.
Okay. And if I have my dates right, the date today is somebody help me, say it, 17th. So was it a week ago that the federal government finally got around to requiring notices for women with dense breast tissue? Yes?
Yes.
Okay. And what is the relevance of this report to making sure that those women are, patients, mostly women, are fully and adequately informed?
That they're informed in terms of the language, or for?
That they're correctly informed if they have dense breast tissue, both as to the fact that it's a risk factor and also as to the fact that it can obscure a good reading. So this issue came to my attention more than a dozen years ago when folks were concerned that conventional mammography was while a useful tool, obviously being relied upon in a way that perhaps, well, not perhaps in my view, in a way that was not appropriate given the difficulty in spotting a cancer when there was dense breast tissue. Now, the technology's changed over the dozen years, which is why I appreciate your walking me through those different technologies. You know, California was among the first half dozen states to require notice for in a mammography report for women with dense breast tissue, and now we have a national requirement, which I believe has just taken effect within the last week. So now you've referenced the report, and thank you for that. What's the relevance of what we have and what we're getting to our ability to provide that information?
So the tomosynthesis is really a great tool, particularly in patients that have dense breast tissue, sort of as you're indicating. And the main reason is because the tissue that's dense, we're able to sort of section through the breast using that equipment, and it allows us to get a better analysis of the type of tissue that's present there. It's an important part of the move towards understanding dense breast tissue and sort of the language that's being used and being required for us to input into our mammography reports. So there's no doubt that tomosynthesis will help us make and detect breast cancer in those patients.
And let me just be a little parochial here and ask you and or Mr. Lorenz, the North County Clinic, which is going to open up, I believe we have a ribbon cutting on the 7th, and we'll actually start serving patients on the 13th
Of November.
Didn't mean to scare you, Mr. Lorenz. What's this newer technology will be in place at that location, yes?
Yes.
Okay. And there's reference in the, I think it was the February report back, that certain staffing enhancements would be needed to support and expand timely access. Has that effort taken place? Is that underway? Do we have the right staff to have the expertise with the right equipment? I don't want to assume or presume here.
So I believe at the time we provided that report in February, there were concerns around the backlog of screening mammography within our health system. And since that time, we have increased our availability of the screenings by leveraging the entire enterprise in all of our locations. And at this point in time, for example, when we are opening up the North County Clinic, we did add additional staff to operate the equipment at that facility. So as we bring online new equipment, we bring on the additional staff, i.e. Morgan Hill, we added additional staff, we're able to provide the service there, et cetera. I'm not sure if Dr. Permine, you have anything further to add to that, but.
Yeah, I think we're always assessing our staffing needs and making adjustments. I think as the construction of this equipment comes through and those are coming online, it's something that we'll work with our administration on trying to make sure we have what we need to operationalize that equipment.
Thank you. I'm going to look to my staff who are here in the room and ask them to follow up with you on this item. I'm not going to ask for a formal report back, but I am going to want to I want to make sure we have an alignment between the technology that's in place and the staff that's in place, and that we're well equipped. Thank you very much, both gentlemen. Supervisor Lee, comments or questions from you?
None, thank you.
All right. Then let me check and see if we have any speakers on this item.
I have no requests.
All right. Can I get a motion to receive the report?
So moved.
All right. I will second. We'll call the roll.
Vice Chairperson Lee.
Aye.
Chairperson Simidian.
Aye. Motion carries unanimously. Report is received, and gentlemen, as I indicated, you can expect to hear from our office for a little follow-up on that issue of staffing. Okay. Thank you very much. That takes us to item number 11, which is our quarterly EMS report. Who's presenting here? Mr. Clay?
I will kick off this item.
Mr. Clay was quick to send it your way, Mr. Williams, so good for you.
Well,
thanks.
And I'm not sure if Nicholas Clay's been formally introduced to the committee, but he's our new EMS director, and we're delighted to have him here with us at the county. And he's already had a very busy first handful of weeks with the county, with the closure of the trauma services at Regional Medical Center and many other things going on. But I'll just kick off this item by sharing that we are in the process of doing a thorough EMS system assessment, which will include outreach and conversation with all the relevant stakeholders, including the fire chiefs, as well as the hospitals and the many, many other system stakeholders. And as part of this, the committee will recall that when the board approved the most recent amendment to the Rural Metro Agreement, it included a number of pilot programs and initiatives. And as those launch and continue to move forward, some of which have already happened, the others, such as nurse navigation, expected to come online by mid-November. We'll be gathering the data associated with that so that that data can also be incorporated into the next iteration of process that we utilize, such as the next RFP for ambulance services. We've continued to do other outreach in the interim, so the committee should know, for example, I presented on this topic and Nick joined me with the Cities Association just the other day. Had I think, a very robust conversation with the city council members, present there. Have continued to have meetings with city managers. I know the EMS agency continues to have its ongoing regular meetings with hospitals and with the fire chiefs as well. So I think this is an exciting opportunity to carry on my theme from the earlier item. Exciting opportunity for us with new leadership in our EMS agency, with some of the new pilots and programs that are being launched to really re-envision a more granular tiered response delivery system through our EMS system and be able to bring something forward. Separate from that, just while we're on this item, to not in the written report, but to give some additional information for the committee, there continue to be a lot of bigger picture statewide regulatory developments, including more litigation. There was another injunction issued in another county associated with a new model, and so that's another thing we're closely monitoring, because I think in the next little bit we're going to see how those cases shake out, which will really, I think, if they're heading the way they're headed with the injunctions, I think it'll narrow the options that are available to the county. So, better to have that clarity one way or the other before we go out with the next RFP. But in any event, we're going to get that, because I think this is now the third or fourth major case in the state that's in active litigation. So with that, we're happy to answer questions. I'm sure Nick is happy to answer some questions as well.
Thank you. I do have some comments. And Mr. Clay, welcome.
Chair Smedian, thank you so much. It's a pleasure to be here.
I want to take advantage of the opportunity to share with you in this setting the concerns that I have had historically, just so you have a little quick sense of what the history on this is from the perspective of one board member. And I have been on this Health and Hospital Committee for almost the entirety of my 12-year tenure back on the board this go-around, except for the first couple of months. When I arrived on the committee back in literally 2013, I was startled to discover, as I made my way through the many reports, that we had pretty much every first responder in the county arriving on scene on time at the contracted level of 90% plus. The one glaring exception was the city of San Jose, which had been repeatedly and over a very long period of time not making that 90%. That was particularly disconcerting and perplexing in my view because we had a system of incentive payments that were made to jurisdictions that met the 90% compliance. And for whatever reason, the decision had been made to continue making those payments to the city of San Jose, notwithstanding the fact that they did not meet the targets repeatedly and over a very long period of time. They were getting the payments. So I leaned in and said, in slightly more elegant language, what gives? And as we discussed it, there was understandably a debate about what the nature of the problem was. And there was some back and forth within the city of San Jose. And I said, well, look, these are the folks that we are relying on to be there before our ambulance service arrives on scene. And, seconds matter in many cases, not every case, but in many cases. And we were, in my view, effectively enabling that untimely arrival because it was being rewarded. The incentive payments were being paid. There was some pushback from the city of San Jose, and folks said, well, it'll be even tougher for us to staff adequately if you take away those payments. And, that became kind of a back and forth circular argument, which is, well, but the payments are for showing up on time, which isn't happening, and that's putting the public health at risk. To the credit of a lot of folks, eventually those issues got resolved, and San Jose came back into compliance. And that was a good thing. And that was the way it was for a great many years then, once they got back in compliance. And then, of course, we had a multiplicity of amendments to our own ambulance provider. And then, within the last couple of years, we discovered that our ambulance provider was having a problem with compliance. And I had, during the course of the last amendment, expressed concern about whether or not the revised contract was sufficiently robust in its penalty assessments to incentivize on-time arrival. And, candidly, I lost that argument, and we went ahead and, passed the amendments. And then, sure enough, when there was a problem, there was a problem, and it didn't get corrected, quickly enough. There were many reasons, explanations as to why they were not able to get there on time in some parts of the county on some occasions. And many of them I thought were legitimate, and I know you know what they are. Just, as simple as it's hard to hire people. So, okay, then you need some training programs, and you need to address compensation and, all that. I think it was particularly frustrating, and this was not a new phenomenon, to hear that it was hard to get good data because our computer systems were, to call them imperfect would be to give them all the breaks, let me put it that way. So we've been working on this for a while, and my exhortation to you, based on that now, in my case, 10-year history, is we need to get our data systems and our technical support systems in place so that we have access to accurate data, and we aren't saying, gee, we can't really give you an answer to that question because, and then whatever it takes to make sure people get to the right place on time when it's, a life emergency, we need to do that. And I know you're new to our organization. I know you're also not new to this set of issues. There will be 2 new county supervisors in January, if not before. And, you know, they may or may not have heard the expressions like wall time, which were new to me all those years ago. I want to encourage you and exhort you, as I say, to wrestle this one to the ground. Because, you know, I have been open to folks saying not every call really requires as timely an arrival. And, you know, for some people can't say that, that's anathema, I know that. But, you know, I understand there are distinctions between the urgency of one call and another. But where it matters, as I know you know. And this has been an issue for too long, and I'm hoping you'll get it wrestled to the ground sooner rather than later. Okay? All right, thank you. I got that off my chest. I feel better. Supervisor Lee, anything else?
Nothing more other than sending a warm welcome to Nick Clay. Welcome aboard. Thank you.
Let's get a motion to receive the report.
So moved.
Did we have
second.
public comment?
I'm going to ask if we have any public comment. Thank you for that reminder.
We do not.
Okay, for the record, there is no public comment requested. We have a motion and a second, and let's call the roll.
Vice Chairperson Lee.
Aye.
Chairperson Simidian.
Aye. Motion carries unanimously. Thank you very much. That takes us to item number 12, report from Facilities and Fleet on the Child and Adolescent Psychiatric Facility Behavioral Health Services Center on the Valley Medical Center campus. Mr. Draper, welcome.
Good afternoon. Mr. Koenig should be online and able to give this report to us.
Yep.
Yes, good afternoon, Supervisor Smitty, Supervisor Lee, Doug Koenig, Deputy Director of Capital Program.
And we're having a little trouble with your audio. I don't know if you can adjust that at all. There we go.
Can you hear me now?
Better, and your lips aren't moving. I don't know how you're doing that. That's magic, but all right. First, let me just say thank you for the photo, and it won't surprise any of you that when we had occasion to be on the campus recently for the naming of the Jeff Smith Way, I, of course, exited alongside the building so I could take a look from the outside, and it certainly looks nice from the outside. That's a start. In all seriousness, I think important that if we believe these services are and the patients we serve are important, and we do, then communicating that through the architecture and design is should not be an afterthought. It looks like we are more or less on schedule, but of course, it says WebCore's latest schedule shows a 29-day delay in substantial completion, which has not yet been approved by the project team. And substantial completion cannot be achieved until the connecting bridge is erected. What would you like to tell the committee about that, and what we might do to try and make sure we don't lose any ground and, in fact, reclaim some of that time?
Right. I mean, the big issue is getting the foundation in for the tower, the stair tower and elevator tower that supports the bridge. HCI said that we cannot get substantial completion until that bridge is in place. So there are a lot of utilities that need to be relocated that were originally part of the emergency.
All right.
The emergency department expansion project. There have delays in that because of the complexity and.
Thank you. We, you will recall we had some, I'm sorry, we're cross-talking because of the
shut-offs and
Apologies from the clerk. There seems to be a slow.
Can you not hear me?
It's a slow connection, so I think there's an audio delay on both sides.
We just have an audio delay going back and forth, which makes the give and take of the committee conversation a little tougher, Mr. Koenig. Not to worry. What I'm going to do is I'm going to ask you a question, or ask a question, and then I'm going to stop talking, and you'll know when I stop talking because there'll be a long pause. We, of course, had asked after concerns about accuracy of timelines and projections, we had asked the folks at our management audit team, the Harvey Rose folks, if they would help us provide some oversight. They have been doing that, and I'm going to go to Mr. Draper. They have been doing that using a consultant or subcontractor, Mr. Draper, and I apologize to them. I'm forgetting their names.
The consultant, oh yeah. I don't know it off the top of my head. Do you remember, Doug?
Mr. Koenig?
Danner is the consultant.
Say again, please, sir.
Danner?
And do we have anyone from?
Veneer, V-A-N-I-R.
Veneer, thank you.
Thank you.
Do we have anyone either from Veneer or from Harvey Rose with us today?
I see Travis Price online.
Mr. Price, can you access our meeting?
Mr. Price, I see that your microphone is live, but I'm not getting any audio input. And the microphone's muted. Microphone's back on. Still not receiving audio from Travis Price.
Can you hear me now?
I can hear you now. It does seem like the audio delay is affecting you as well.
The audio is unintelligible, so we're going to solve this the old-fashioned way and ask for some paper. So, Mr. Draper, Mr. Koenig, and folks at Veneer, Mr. Price, could we please get an off-agenda report on the accuracy of the timeline that is contained in our published agenda today? So we have in our published agenda today, item 12, it begins at packet page 78, and it would appear that with the exception of the bridge, that we are still relatively on schedule. I would like to ask that the folks at Veneer, who are on contract to essentially provide confirmation of scheduling, provide us with a written confirmation or an indication that the schedule is, in their view, in some way subject to concern, maybe different, whatever. And Ms. Price, can you hear me well enough to just say something unintelligible that indicates you heard that request loud and clear?
Yes, I can hear you.
Thank you. We're still having a little trouble with you, but I got the yes, and that was good enough. So, Mr. Draper, I think you understand what I've asked for.
I do.
And Mr. Koenig, I think you understand what I've asked for. And I appreciate the fact that we are pretty close to on schedule with the exception of that one item. Mr. Draper, I don't know if you're close enough to it to respond, but any reason to be worried that 29 days could slip and become even longer, or?
It's been identified as a possibility. I do think it's worth checking into.
Okay. Let's get a written report back and an off-agenda report then. And do I read the numbers correctly? If I look at packet page 81, it indicates that at our October 17th meeting of the Board of Supervisors, we approved the final guaranteed maximum price of $423,775,783. And then later there was an approved change order in connection with the Skyway Bridge, I believe, that was $21 million and change. Does that mean that if I add those two numbers together, that's pretty close to what the project is supposed to turn out to cost?
It's pretty close to that.
Okay, thank you. I just want to be accurate when I answer questions about cost. Thank you. I have what I need. I look forward to getting the confirmation. I'm looking to my office staff to make sure that we follow up on getting the timeline confirmation. Supervisor Lee, anything on your end?
Nothing to add. Thank you.
All right, then can I
Move
get
to receive report?
a motion? We have a motion then to receive the report. I will second. Let me check with the clerk, make sure we have no speakers on this item.
That's correct.
All right. Then let's call the roll.
Vice Chairperson Lee.
Aye.
Chairperson Simidian.
Aye. Report has been received. Thank you, everybody, for helping to work our way through the technical challenges, Mr. Draper. Then that takes us to item 13, which is the effort to establish a new De Anza West Valley Clinic on the De Anza College campus. And Mr. Draper, what would you like to tell us about this?
We had received comments from, or markups, red lines, to our letter of intent to do a ground lease with the college. And we have replied to those red lines, and they are huddling to discuss their next steps. That's where we are today.
Okay. This is, for those who are new to this conversation, this is in response to a referral from Supervisor Lee and me. It's a challenging venture for a number of reasons, not the least of which is we have two immense bureaucracies that are separate and apart from one another. They're both subject, we're subject to our whole set of rules and regulations. They're subject to their whole set of rules and regulations, which are different than our whole set of rules and regulations. And to the best of my knowledge, we've not ever really worked together on a significant project before in the past. So it's all going more slowly than I would like. I know that's not a surprise to you, Mr. Draper. Your report seems to indicate that we're hoping we'll actually have a letter of intent by the end of the year. I do think, and I think there was some very artful, tactful language indicating that there was still some work to do in the community college system in terms of working with stakeholders there to make sure everybody was on the same page and understood what was happening and what wasn't happening. I myself went to one of those meetings, and I thought it was clear that there were a lot of folks who still had unanswered questions to which there were good answers if we can get them to them. So that's to the good. If we have a letter of intent by the end of the year, could you give us a rough outline of what happens next and how long that's realistically going to take?
Yeah, I'm assuming if we have a letter of intent, the board would approve it, that it'll become part of the capital improvement program that we'll be considering in the next fiscal year.
And my recollection is, Mr. Williams, that we didn't have money this fiscal year, meaning 24, 25, even for design, and so, which at one level was sort of a moot point since we didn't even have a letter of intent, let alone an actual lease agreement. Am I remembering that correctly?
That's correct. So we don't have money set aside currently, but that's something that would then need to be taken up in future budget cycles, beginning with design. I do just want to say one thing on the letter of intent piece. I think we're really seeking some clarity from the community college district because, I feel like there's several really core material terms, and we'd be happy to brief you separately on this, but that there needs to be clarity from the district that in order for this to really be moving forward. So that's, I think, where we're at, which is, there has to be a meeting of the minds on what we're talking about here, and not things like, is the county gonna make payments to make up for, flea market rents, by way of example, which is really not in alignment, I think, with the vision around this project. So,
okay, and given the fact that property matters are typically often closed session items, what's the best venue or means in which to have these conversations, or means by which you can inform members of the board or members of this committee, or I'm just trying to figure out how do we make sure that happens and still follow all the rules and still be as transparent as we can while still getting the work done.
we can certainly individually brief board members, or we can certainly bring an item to closed session.
Okay. I'll look again to my office and say we'll follow up with you on that. Is it fair to say that it sounds like you have some significant concerns that we may not yet have arrived at a substantial meeting of the minds?
I do.
Okay. Let me just point out that at the end of this year, it will be 2 years and 9 months since this referral was brought, and that certainly should be long enough for folks to get to, yep, we want to do it, or nope, we don't. And I don't want to in any way dismiss the complexity of an endeavor like this, but you know, I think it's a 20,000 square foot building, if I remember correctly.
That's correct.
And it's 2 stories, which means it's kind of 10,000 square feet on top of 10,000 square feet, which means that's about a quarter of an acre on a vast parking lot. And it shouldn't be that hard to say, put it over there, or we don't want to do it. So Supervisor Lee, no pressure, but we don't know if Mr. Ahrens, who has been a trustee at the Community College District, is going to be there or not after this year, and we know I won't be here, so hoping that those who remain can and will push ahead. Okay. Any speakers on this item? Open it up.
There are no speakers on this item.
All right. Supervisor Lee, comments or questions from you, and then a motion to receive the report, please.
No further questions. Move to receive report.
We have a motion by Lee and a second by Simidian. Call the roll, please.
Vice Chairperson Lee?
Aye.
Chairperson Simidian?
Aye. Report is deemed received on a unanimous vote. Thank you very much. And then that takes us to the report for the Valley Health Center, and I kind of tipped my hand on this one a little bit earlier. Report from the Santa Clara Valley Healthcare and the Facilities and Fleets folks regarding the establishment of a new Valley Health Center in North County. Who'd like to present?
Well, I'll say the few words, and then we'll go on to whatever else you would like to discuss, which is simply that the county has received the certificate of occupancy to, we finished the construction portion of the project. Right now, we're in the, the staff and stock and licensing phase, and I think that's been going very well. So that's my report.
Mr. Lorenz, anything else?
Nothing further other than, as Jeff has mentioned, we are in the staff and stock phase, and that is going well. And we fully expect that we will have our license in hand to see the first patient in November.
Great. And I want to revisit an issue that I know is of, for different reasons perhaps, is of interest and importance to both Supervisor Lee and myself, and that's we do expect this to provide some relief for the Sunnyvale Clinic as well, yes?
Yes, we do.
Good. Well, I'll just say thank you, and I look forward to seeing you at the ribbon cutting. And Supervisor Lee, comments or questions?
No further questions.
Okay. Any speakers one more time want to double check?
I have no request to speak at this time.
Then on this one, I'm going to take yes for an answer and say, please call the roll. Motion and a second by Lee and Simidian, respectively.
Vice Chairperson Lee?
Aye.
Chairperson Simidian?
Aye. Motion carries unanimously. Thank you. And Ms. Draper, just so you know, in my shorthand notes, I on the agenda, what I did was I wrote 2024 next to this one, 2025 next to the facility at the VAMC campus, and who knows next to the De Anza site. So that's kind of where we are, 24, 25, and who knows. That takes us to item number 15, which is sort of our omnibus item. We have a number of items here. Receive report from the Chief Executive Officer of the Santa Clara Valley Healthcare. Mr. Lorenz?
Yes, Chair Simidian, just a brief update, and really I want to take this opportunity to acknowledge the staff. As you well know, since the closure of Regional Trauma Center, the volumes at Valley Medical Center have substantially increased. Since that notice, we've seen a 50% increase in our trauma volume. On some days, we'll see trauma patients.
Sorry, Mr. Lorenz, would you say that again, please?
A 50% increase in our daily trauma volumes on some days. And in terms of numbers, we're looking at 20 to 23 traumas a day. And the staff have done a remarkable job in adjusting to that volume to ensure that there is timely care, and the quality of care, frankly, as far as I'm concerned, is unsurpassed relative to what we as a public system can offer. And so I'm very pleased and just want to acknowledge the hard work of the physicians, the nurses, and the staff at Valley Medical Center. And I would also add that not only have we seen an increase in our trauma volume, but our ED volume has also substantially increased due to the change in the market conditions around regional. With that being said, I have nothing further to report.
Thank you. Supervisor Lee, anything else for Mr. Lorenz?
No, thank you.
Thank you. Then we will go to our public health officer. And Doctor, anything else you want to add?
Nothing further, thank you.
Supervisor Lee, I'll look to you to lean in if and when. Takes us to item C, which is a report from the Director of Behavioral Health. Anything else, Mr. Rao?
Yes, good afternoon, Supervisor Simidian and Supervisor Lee. You had requested a oral report and update on the West Valley mental health update for this meeting. Just a couple of notes on that one. Our Behavioral Health Navigator program expanded into West Valley to provide regular navigation services connecting individuals to county and community resources for mental health services. In-person behavioral health navigator services continue to be available at Los Gatos Public Library along with West Valley Community Services. And we will be submitting our annual report on the Navigator program for the October Health and Hospital Committee meeting. So we will provide much more detailed information in that report. Related to the TRUST program, we have extended those services to the West Valley, focusing on urgent mental health needs through phone-based screening and on-site interventions by a specialized team. And so TRUST is fully operational in the West Valley region. Finally, an update on our partnership with Pacific Clinics. There is an agreement between Valley Health Plan and Pacific Clinics, which is in the hands of Pacific Clinics for signature, and so that should be implemented shortly. It was approved already by the county. That service expansion agreement will extend services to cover various groups, including commercial employer groups, Covered California, individual and family plan, and Medi-Cal beneficiaries, and those services include individual and group psychotherapy, psychiatric consultation, medication management, health navigation, and crisis intervention. So many of the requests related to West Valley mental health are underway or currently in action, and so we wanted to provide that oral update to you. Thank you.
Thank you. Forgive me if it's in the materials. I don't think it is, but do we know, are people actually accessing the navigators in Los Gatos and West Valley Community Services?
Yes, they are, and we will have a report on the utilization in our report next month.
Thank you. This goes back to the comments I made earlier about it's great to have great programs in place, but if people don't know about them and access them, to what end? So, thank you.
Thank you.
Supervisor Lee, I'm going to keep moving until you lean in and tell me otherwise. All right. Then that will take us, of course, to the CEO office from Valley Health Plan.
Good afternoon, supervisors. My name
Ms. Fan, is it? Go ahead.
Good afternoon, supervisors. I don't have anything else to report besides the written report, but happy to answer any questions.
I think we're good. Thank you very much. And then we go to Custody Health.
Good afternoon. For Custody Health, nothing more to add. Happy to answer any questions.
All right. Seeing none. That takes us to EMS. Mr. Clay, anything else you want to ask or answer or respond or?
I would just like to thank you for the warm welcome, both of you, and I look forward to continuing to address these issues you've raised and wrestling down to the ground.
Well, you're very gracious, and when you can call a forced 10-year history a warm welcome, you're going to go far in life, sir, so thank you for that. All right, and ordinarily we would hear from Mr. Margolin at this point on federal and state health policy, but as it happens, we heard from Mr. Margolin earlier today in our Federal Affairs Advocacy Task Force and told him there was no reason to repeat the same information twice to the same two members of the board today. So I believe that's it. Let me check with the clerk to see if there's anybody who wants to speak on this item 15.
There is not.
All right, then a simple motion from Supervisor Lee to receive the report.
Motion to receive report.
I will second. Let's call the roll.
Vice Chairperson Lee?
Aye.
Chairperson Simidian?
Aye. Motion carries unanimously. The reports are deemed received. Thank you all for being here today. And what that means is that having previously approved the consent calendar, we are in a position to adjourn until our next regularly scheduled meeting, which I believe is Wednesday, October the 16th. Thank you all very much. Supervisor Lee wants to get the last word, and we're going to let him.
Here's a brief comment. Just want to wish everybody a joyous Mid-Autumn Festival today and tonight. This is actually the basically second most important holiday for those countries and cultures celebrating the Lunar New Year being the most important ones on the 15th of the 8th month of the lunar calendar. This symbolizes unity, harmony through a day of remembrance of loved ones, hopeful wishes, and time with family. Similar to Thanksgiving, that many families would come together and celebrate. So I'm wishing everybody a wonderful evening. And along with the issue with diabetes, we just recommend people not to eat too much mooncake because it's very sugary. Thank you.
On that healthy note, we stand adjourned.